What's irritable bowel syndrome? Why has it become common among Indians? Explained. The irritable bowel syndrome (IBS), characterized by abdominal discomfort associated with altered bowel movements, affects about 10% of Indian population. It is a disorder of the gut-brain interaction, which causes the gut to become more sensitive and reactive in response to diet, infections, and emotions. Recent research has shown that many symptoms of IBS are related to hypersensitivity of the nerves found in the wall of the gastrointestinal tract. These nerves are distinct from those in your spinal cord and brain. What are the types of IBS? There are 4 subcategories of IBS, each with equal prevalence: mostly diarrhea and abdominal discomfort (IBSD), mostly constipation and abdominal discomfort (IBSC), alternating loose stools and constipation with abdominal discomfort (IBS mixed). Undefined subtype IBSU symptoms vary. What are the symptoms of IBS? Symptoms include abdominal pain, bloating and changes in bowel movements, which may be diarrhea, constipation, or feeling of fullness or even burning. The pain may be triggered by eating specific foods, following a meal, emotional stress, constipation, or diarrhea. Other symptoms include mucus in stool, urgency and feeling of incomplete evacuation. Though patients have these symptoms, they do not have any visible signs of damage or disease in their digestive tract. IBS is a chronic condition. It does not increase one's risk for colon cancer. Other risk factors for IBS include having a family member with IBS, a stressful or difficult life events, and having had a severe digestive tract infection. Females tend to develop IBS more likely than their male counterpart. Why IBS has become common in India? Some doctors say that the spicy and high FODMAP fermentable oligosaccharides, disaccharides, monosaccharides, and polyols diet prevalent in Indian cuisine is a significant contributor. FODMAP foods include legumes and certain vegetables: onions, garlic, cauliflower, broccoli, wheat products, and certain fruits. Apples, mangoes, grapes, are poorly absorbed in the intestines, leading to digestive discomfort, bloating, gas, and abdominal pain in people prone to IBS. The fast-paced lifestyle, work pressures, and emotional stress prevalent in modern Indian society can contribute to the development and exacerbation of IBS symptoms. The shift towards an increased intake of processed foods and an inactive lifestyle, particularly in urban areas, may also contribute to the rise of IBS, said Dr. Virendra Palbala, Clinical Director, Gastrointestinal Surgery, Marengo Asia Hospital, Gurugram, as quoted by India Today. What is the treatment? According to Johns Hopkins Medicine, there are currently no laboratory tests or imaging tests to diagnose IBS. A trained and experienced gastroenterologist can distinguish the classic symptoms of IBS from other symptoms that might prompt an evaluation to exclude other diseases. Regular diet and exercise can help maintain ideal or near ideal body weight, keeping oneself active and energetic throughout the day. Swipe left for next video. Meal changes may include increasing fiber in the diet, limiting dairy products, and avoiding gassy foods like beans, dal, cabbage, and carbonated sodas. Dietitians may also advise a low FODMAP diet, reducing hard-to-digest carbohydrates and drinking plenty of water. Medications to relieve persistent symptoms include laxatives for constipation, antidiarrheals for loose stools, and antispasmodics for intestinal cramps. Latest blogs.